Hello guys, welcome to our YouTube channel. Today we wanted to talk about vaginal delivery and learn a little about benefits and disadvantages of it. So if you are interested in medical world and these types of topics, subscribe our channel and be with us. A vaginal delivery is when a person gives birth through their vagina. It is the most common method of childbirth. During a vaginal birth, your uterus contracts to thin and open your cervix and push your baby out through your vagina or birth canal. Healthcare providers prefer vaginal deliveries because they are usually safest for the fetus and the birthing person. A vaginal delivery occurs most often between weeks 37 and 42 of pregnancy. A vaginal delivery can be broken into three stages: labor, birth, and delivering the placenta. The first stage of labor begins with uterine contractions and ends with your cervix being 10 centimeters dilated and 100% effaced. Labor can be classified as early labor, active labor, and transitional labor. Early labor is a time when contractions begin and your cervix starts to open and thin. Your cervix may be about 5 centimeters dilated at the end of early labor. Active labor is a stage of labor consists of strong contractions that last up to 1 minute each and happen about 5 minutes apart. Some people request an epidural during this time because contractions can be painful. Healthcare providers may also give you oxytocin to speed up labor. Transitional labor is the time just before your cervix is 10 centimeters dilated. It's short but intense time when your contractions come very quickly and last longer than 1 minute. This phase may make you sweat, vomit, or feel shaky. It happens just before you begin to push. The birthing stage begins when you reach 10 centimeters and ends with the birth of your baby through your vagina. In this stage of labor, you experience strong contractions and begins pushing. You may feel pressure or like you need to poop. Your healthcare providers may coach you through pushing, especially if you've had an epidural and can't feel contractions. This phase can last a few minutes or a few hours. Generally, birth is quicker if you had a prior vaginal delivery. The last stage of labor is delivering the placenta. It begins after your baby is removed from your vagina and ends when your placenta is delivered. Your healthcare provider may ask you for a few more pushes. This stage begins a few minutes after your baby is born and lasts up to 30 minutes. It's important to remember that labor and childbirth are different for everyone. Certain factors can play a role in your labor being longer or shorter. For example, if you get an epidural, you won't experience the same pain level as a person who doesn't get an epidural. Also, your labor may be longer if it's your first baby. Factors like the size and position of your baby and how quickly you dilate can all affect how long a vaginal delivery takes. Now let's learn a little about advantages of vaginal delivery. As a matter of fact, in vaginal delivery you have faster recovery and also you have lesser bleeding than cesarean. And also breastfeeding is happened for you within 2 hours. And resumption of diet is easier than cesarean. And duration of staying in hospital is less than cesarean and it takes 40 hours for you. Postpartum depression is less for you and also it costs cheaper for you. Thank you for being with us until the end of the video. If you're interested in watching these kind of videos and you're interested in medical world, be with us and subscribe our channel.